Hey everybody, called Rothschild here. I have Dr. Rob Mayer with us, and he has a Pro 450 Trifecta Light bed, and he's had some pleasant experiences with it, both for his patients and for his business. So first of all, Doc, how you doing?
Man, I'm doing great. Thanks for having me today.
My pleasure. And how long have you had the bed?
We've had the bed right at 2.5 years.
Oh, beautiful. And so, there's a couple of things that people want to know. Does it make sense for them to purchase for their own practices? And how is it done for your patients? So, from a business point of view, how do you look at this? How has it helped and affected your practice?
Well, it has definitely developed a pretty seamless, effortless income stream for the office. So we tend to sell packages of them. We don't do memberships. We sell packages, and we sell packages at 10, 20, and 40. Um, and then we do social market. And I can tell you that we had a little bit of a summer drop off, which we always have with practice. I've been practicing for 32 years. I'm used to that. But right now we are literally scheduling, about a week and a half out. So our schedule is pretty well booked. We're open 8 hours for business and we book every 20 minutes. So yes, so it's working out beautifully. And let me just tell you why everybody should have this. So I don't care what you're doing in terms of if you're a chiropractor or physical therapist, massage therapist, if you're dealing with anybody who is dealing with any kind of pain, this is just going to basically amplify anything you're already doing. So we tend to stack red light with what we do. So I'm a chiropractor, so we obviously do adjustments. We do some shockwave therapy. We use soft wave in the office, decompression, and we couple soft wave with all of these, and it just amplifies our results. But one of the things I love about the trifecta is after 32 years of practice, you'll have people come in and we have a little form they fill out and they've got to like put X's where they have pain. And some people come in and you should just give them a crayon and they color the whole body. And when people come in with that, the first thing I obviously look at is like autoimmune. What do they have going on? High inflammatory type stuff. And those people, my first recommendation before I do anything is let's try 10 sessions on the red light bed. And I always tell them it's one of the most cost-effective therapies in my office for the patient, and it's the only way I can actually change the entire body. So we're going to dose the entire body with this beautiful healing cascade, and that has changed these people's lives. So I have a lot of these patients that before I start any adjustments, any other kind of therapy, we start with just straight red light, and these people's lives change. Pain drops, more energy, sleeping better. It's just amazing to watch these people change. So those people, even after 32 years, you're kind of like, where do I start? Do I start with their neck, their low back? Now we just like, hey, you're going to try red light let's try 10 sessions of red light. And we usually do 3 to 4 times a week. So I'm seeing them 2.5 to 3 weeks on that. And then I reevaluate and decide what we're going to do from there. And a lot of these patients, I don't have to do anything after that. We just keep them on red light, but then other ones we may get on decompression, other stuff. So it just really helps to smooth out and make the transition for patients a lot better. And the reason patients love it is because it just helps with so many things. So that their pain may drop. Oh my goodness, doc, I have more energy. I'm sleeping better at night. All the things that we see with red light. So it's just been a phenomenal tool. And I don't care what kind of patients you're treating or clientele you're treating. I always say the first three things we see with red light are decreased aches and pains, better sleep patterns, and more energy. And I'm going to tell you, 95+% of everybody walking through my door needs decrease in pain, better sleep patterns, more energy. We are a messed up society. So that's how we tackle it, and that's how we use it, and it's been fantastic. But from just a straight healing standpoint, I always tell my patients it's the only piece of equipment that I use every single day that I'm in the office. So I mean, I love it. I mean, it's changed my life. I'm an old broke down athlete approaching 60 years old, and my aches and pains have dropped tremendously. My energy levels are up. I literally at noon, my front door locks. I go in for my 12-minute session. I go straight to the gym. Absolutely love it.
That's beautiful. So let me ask you a question. A comment that people make was, "So, can I expect a decent return on investment?" And how would you describe that to them?
Yeah, I mean, and I tell people, I don't know, what your area will handle, what you can charge, but I can tell you that we get anywhere from about 50 to about $100 a session. And so if you buy my big package, we can get down to as less as, so let's just do simple numbers. So my bed can, if we're full, I can make $150 an hour because we get every 20 minutes. Times that by 8, that's a pretty good return, over $1,000 a day, right? So that means you'll pay this bed off in a couple of months. So yeah, it's been a great revenue source for us, all cash, so you don't have to deal with the insurance side of it. Yeah, it's fantastic rev. The ROI, if you can't pay this bed off in the first, I would say 6 months, you're definitely doing something wrong.
I really appreciate your feedback. This is very helpful. I think people out there are going to really want to hear this. And so what I want to tell you is have a great rest of your day, and thanks so much.
No, you're more than welcome. And, Doc, you're always, you can always pass my number to people, and I'd be happy to talk to them if they have any questions. That's available as well. And I want to say thank you. You're the one who really talked me into getting this bed originally. So I wouldn't be sitting here if it wasn't for you. So it's been a huge change to our practice. We appreciate that as well.
That's great. Well, thanks so much.
Thank you much, Doc. Thank you very much.